Hi, this is Dr. Kathleen Hallinan, and today we're doing a different topic. I hope if you know anyone who is suffering from opiate addiction, narcotic, drug addiction, that you can share this with them, share this with their family, if it is at all helpful. And I generally have done these videos to help people with all the things that cause them to have medical illness, and often that, again, is based on things like weight and lifestyle. But to be honest, the other area that I help people in, I do treat people who are suffering from and recovering from narcotic, heroin, opiate addiction. It's very gratifying when people are ready to be in recovery. And I'm going to share with you a little bit about the medical end of things, so please feel free to share this. If it's not your interest, I did another weight loss video already today. So this is about opiate and narcotic addiction, and something called medically assisted therapy, which is the treatment that can be done by primary care. The primary care provider has to have a waiver, which means they have to take a little course and take a little test, which is relatively easy to do, and that allows them to write for a medication, the generic name of which is Buprenorphine. The branded name is Suboxone, and this is used to help people who are actively using come off their drugs without suffering through severe withdrawal symptoms, and then it helps them stay away from narcotics. It blunts their cravings. It really is an impressive medication when it's used correctly. Can it be misused? Absolutely. It has a street value because what does it do? It's used by physicians in the right way to blunt the effects of withdrawal, to stop people from being in withdrawal, and to keep them from craving. So people who are not ready to quit and get their hands on some what they call subs oftentimes will use them to keep out of withdrawal in between when they're using. So certainly it can be misused. Don't get the idea that it's a panacea. It certainly has its downside. However, when it's used correctly, I have patients who have been really heavy addicts, and on Suboxone therapy, they have been able to get their life back. They have their kids, they have a job, they have a car, and they are not craving. They're able to stabilize themselves enough to get the right psychiatric help because quite often people who have suffered through heroin and narcotic addiction have either underlying mood disorders that will benefit from treatment with mood stabilizers and antidepressants, and that really should be done. If you know anyone who is suffering from addiction, it's very important that they get on the right cocktail of things to help calm their thoughts, help decrease the agitation, the anxiety, the depression, and that they use something similar to Suboxone. Methadone is used at centers. There are methadone clinics. However, you have to have a large facility and be a certified methadone clinic. So in more rural areas, that's not an option. So for us, the only option is, as a primary care provider, is to get your Suboxone waiver and write for this for people to help get them off narcotics. So how does this work? Well, it has a very strong affinity. There are actually 4 different category types of opioid receptors. You can tell they really didn't have a lot of creativity when they named these: mu, delta, kappa, and opiate receptor like 1 receptor. So that's what they named these. So buprenorphine has a very strong affinity for the mu receptor, much more than morphine and fentanyl. It will kick those off of this receptor, actually. And so that's why generally when we start people on buprenorphine, we have them come into the office in moderate withdrawal. They should be feeling moderately sick, meaning fidgety, nauseated, nose running, tearing. If you've ever seen somebody in withdrawal, they look gray. They look really sick, and if you didn't know that it was opiate withdrawal, you would think they were really sick. So if they're not in moderate withdrawal and you give them buprenorphine, you can sometimes precipitate a withdrawal, which is why we like to do this in the office, have them sit for half an hour to an hour, make sure they don't suddenly feel worse. It's hard to fake it, but usually you can tell. If somebody's not in withdrawal, then you would not be so inclined to just dose them right out of the blue, because they might have a lot of opiate in their system and you might make them feel really sick. But when people come in moderate withdrawal and you give them buprenorphine or Suboxone, it is really amazing. After about an hour, all of their withdrawal symptoms just improve and are getting better. Their color looks better. They are less fidgety. They're less agitated. The nausea starts to improve. They're not having all the secretions. So all of the symptoms of withdrawal are improved, at least in the short term, very dramatically by dosing with Suboxone. And then the very interesting thing is that this kappa receptor is activated by opiates. And this kappa receptor tends to be kind of a self-fulfilling prophecy. The kappa receptor causes people to be anxious, to drug seek, to need more of what activated it in the first place. Buprenorphine blocks this receptor, and so blocks a lot of the feeling of anxiety and drug seeking that the plain opiates were causing by turning this receptor on. Buprenorphine blocks this receptor and blocks that vicious cycle of seeking and anxious and all of that. So the other thing is that actually it has some antidepressant activity by blocking this site. So it's a fascinating set of activity at these sites in the brain that really, when you think about it from an evolutionary standpoint, were meant to keep us from pain. You know, you hear all the time about people in wars getting shot and not knowing about it until, you know, a little bit later. Well, why is that? Because you have opiate receptors and your own endogenous or from inside yourself endorphins can lock onto these receptors and keep you from feeling tremendous pain. Well, so nature gave this to us, but they have been like hijacked by opiates and heroin and fentanyl and all sorts of things. So if you know anyone who is suffering from this, please find a provider who treats ethically with Suboxone and doesn't just kind of you know, it puts some thought into it and helps these people. It's a very therapeutic approach to get these people from feeling like they're constantly seeking. It allows them to get away from the narcotic without going through withdrawal. But again, I do warn you, yes, this medication has a street value. People will steal it. People will sell it because it takes away the suffering from going through withdrawal. So so I hope this is helpful. I know it's not the usual weight loss video, but please, if you have anybody, friend, family, coworker, whatever, who has someone struggling with this, feel free to share it with them. You guys are great, and thank you very much.